There we go. And we should have all of our attendants have just joined. All right, let's begin. Hi, y'all. My name is William, and I'm speaking on behalf of UVA's Orientation and Transition Programs Office, and welcome to our Wednesday webinar series. Wednesday webinars, these are designed to help prepare you for your arrival at UVA. Tune in over the summer to learn more about resources and programs available to you before you get to grounds. Wanted to share a couple general reminders before we begin. Um, with the many deadlines that are coming up in your new student portal, make sure you're staying on top of all your tasks so that you're ready to roll for this fall. You can access the new student portal from our website, orientation.virginia.edu. Also, make sure you're checking your UVA email regularly. We communicate directly with students, so it's important that students are keeping an eye on their inbox for important messaging, and it is essential that you take ownership over your college experience as you begin this new phase of your life. That said, our office is happy to hear from students, and if you have any questions, you're free to email us at orientation@virginia.edu and we will help guide you towards the answers you're looking for. Whew, all right, two more things to remember. Recordings of this webinar will be posted on our website. Again, orientation.virginia.edu within the next week, and they'll live there for the rest of the summer. And if you have any questions at the end of the webinar that aren't answered by our presenters, please feel free to reach out to the respective office directly. Now, without further ado, I'm happy to introduce this evening's presenters from Pre-Health Advising at UVA. And our friends here are here to talk about all they provide for students during the school year. And we understand you may have some questions for their team. Please utilize the Q&A function at the bottom of your screen to ask questions that'll be brought up at the end of the presentation. We're so excited to have y'all with us tonight. Enjoy. And with that, take it away, y'all.
All right, thank you so much. Really appreciate it. Welcome to the Pre-Health Advising Wednesday webinar. This evening, we're going to provide an overview of the UVA Pre-Health Advising resources and services that is specifically geared toward preparing you for course registration, thinking about orientation when you're going to be making those registration decisions. In addition to this webinar, we will be doing a presentation during orientation, so keep an eye out for that. And there will also be advisors during your registration. The pre-major advisors are not pre-health advisors, but they have some information that can help you in your registration. So to get a feel for who is here, can you add in the chat which of the following professions interest you? And I'm going to say those professions in just a minute. If you haven't already, please do scan the QR code on the screen to sign up for the Pre-Health Pulse newsletter and make sure that you have all the up-to-date information from Pre-Health Advising during your time at UVA. So what I'm asking you to do is put in the chat which of these professions interest you. So dentistry, medicine, occupational therapy, optometry, pharmacy, physical therapy, physician assistant or a physician associate, podiatry, and veterinary. And I actually don't have the chat up, so I'm looking to see. It doesn't look like maybe you are able to put in the chat. Is that right, William?
Yeah, that should be correct. Yeah, and the let me see if I can change that. There we go. Everyone should be able to post in the chat now.
Awesome. Okay, so if you can tell us, just kind of polling to see your interest in each of these professions. When we think about pre-health, we think of it as an umbrella term used to describe a variety of clinical health career paths. And we define clinical health as those that are working with patients, as opposed to healthcare administrators, health educators, biostatisticians, epidemiologists, other healthcare colleagues. So we do have colleagues in the Career Center who work with non-clinical healthcare careers. Thank you to those of you who have put medicine. I think we've only seen medicine so far. So the majority of pre-health students are interested in medicine, but we have significant, thank you, physician assistant, pharmacy, And some of you might be exploring what health profession, clinical health profession you might be interested in. There's dentistry. Thank you all so much. This is super helpful. We also have opportunities to explore some of these different careers if you think maybe I might be interested in figuring out which of these is right for me. So you will note that nursing is not on this slide because our nursing school actually is the one that advises students who are interested in nursing. But we work with these clinical health professions, and we will talk with you about everything from exploring what works for you to preparing for a future application in this area to actually applying to health professions programs. All right, moving right along. There we go. So you may already know this, but at UVA, you're going to have a large number of advisors. So this is your network of advisors, some that you will work with throughout your undergraduate years. You will note we are only this group, this team is your pre-health advisors, and we are specifically here to support your progress from right now as you prepare to be a first-year student at UVA, all the way through the time that you apply, whether that's during your fourth year at UVA or beyond. This is our crew. So my name is Kim Whitney, and my colleagues here, Kyle and Kate. And we're missing Brennan today. She's at the beach, but she will be back and ready to advise you when in the fall. We also have graduate students who assist us and 10 pre-health advising peers who are here to kind of round out the pre-health advising staff. And then we work with approximately a third of the first year class who identifies as pre-health in some way, shape, or form. So our goal today is to prepare you for your course registration during orientation. We have a number of advisors, as I mentioned earlier, who will be at orientation, but pre-health advisors will be there at a particular presentation on day 2 of orientation. So we encourage you to sign up for the Pre-Health Pulse newsletter. This is my second advertisement for that. It will come up one more time, but be sure to grab that QR code so that you can go ahead and sign up. We will be sending information to you throughout your time at UVA, and we want to make sure you have the most up-to-date information possible. All right. So this is how we think of pre-health at UVA. Our pre-health pillars advising model incorporates 3 essential components of preparation for success in application process to a health professions program. Initially, as you can see, any student pursuing a health profession will demonstrate interest in the profession. That's the foundation. And then from your interest, there are 3 areas of development that you will complete to be successful. Your academic development, which includes a demonstration of strong academic performance through prerequisite coursework, your GPA, entrance exams, and letters of recommendation. Second pillar is your career pillar, career development, understanding your chosen career field, including clinical experiences, knowledge of the profession, interaction with patients, and intentional career exploration through shadowing and clinical exposure. And then third is your personal pillar, your personal development. This is not to be underestimated. This includes your life experience, your personal growth, your self-awareness, resiliency, service orientation, cultural competence, maturity, integrity. There's so many different ways. And this is the one that's kind of less measurable. Whereas academics, you have that number, that's your GPA or your entrance exam score. Your career pillar has the hours of clinical experience. The personal pillar is really what makes you you. And it's hard to measure, but there are lots of ways where you will be developing that over time at UVA. So combined, these 3 areas of development lead to acceptance in your health professions program. We are going to talk about academics next, and so I'm going to hand it over to Kate, who's going to talk to you a little bit more about that.
Hello, everyone. So nice to virtually meet you all. I'm going to be talking a little bit about what academic components are important to consider starting in your first semester at UVA. So to begin, what exactly is pre-health? What does that mean? An important distinction here is that it is not a major. Some schools may have majors or minors for pre-health students. That is not the case at UVA. It is a track. And so, our way of tracking you guys and getting in touch with you all, being able to provide you with resources, is for you all to subscribe to our newsletter so that we know that you're there. We know that you're interested in pre health. There's nothing you'll declare on your degree that will say, I'm pre med or I'm pre PA or something like that. And so, it's helpful, hopefully, for both of us to sign up for our newsletter. This also means, in addition to pursuing a path in clinical healthcare, you will also need to choose a major in a discipline at UVA to graduate. Health professions programs require specific prerequisite courses for admission, but they have no preference on the major that you select or whether you pursue a Bachelor of Arts or a Bachelor of Science degree. You should really select the major that you enjoy and in which you'll display strong academic performance. If you like your classes, you are more likely to do better in them. We know that a lot of students come in with interests in biology, biochemistry, global public health, and those are all wonderful. If that is where your area of passion is, then great. But know that we've had successful applicants to medical school and other health professions programs from all of these different majors, so you are not limited in what you're able to explore as long as you take those required classes for admission. So getting to prerequisites, this is hopefully an info that will be helpful for you for course registration, which you will do at orientation over the summer, and for starting your first semester at UVA this fall. These are the most common prerequisites for both medical school and other health professions programs. The QR code will take you to a page that outlines the specific requirements by profession. Do not worry about all 4 years right now. We are going to advise you for your first semester, and then after you arrive at UVA in the fall, you can meet with a pre-health advisor to map out all 4 years of prerequisites if you'd like to, specific to your profession of interest. So, looking at what we want to think about for the fall semester, these next two slides are going to look a little similar because we want you to focus on two important topics when it comes to prerequisites in your first semester. The first one highlights that every student's pre-health path might look a little bit different. Still, pre-health is open to you regardless of how you orient your first semester. So not getting into a class does not mean you can't be pre-health. Deciding that you want to add on in your second year, that is totally fine. This is not intended to be limited. This is intended to be guidance for those of you who are interested in getting a head start on this path. A lot of our successful students do start with one science course, so one lab science course, usually either chemistry or biology. You can choose which one. Often, usually we've had people start with chemistry in the past, but chemistry is, they're working towards offering that in more semesters, and so there may be more possibilities for that. But one lab science course, so you can just get acquainted with what does it look like to take a lab science at UVA? How is that different even from coursework you might have had in high school, whether it was AP, honors, or just a regular class? Also, some other things that a lot of successful students think about with their first year, and again, that's partially your first semester, but there's still plenty of time for you to take those classes, would be a behavioral science course. So we are by behavioral science, we're usually talking about a psychology or sociology course. Those are required or recommended by many types of health professions programs. And then a math course. Most of these health professions programs will require a math. Statistics is more commonly required than calculus, but some of them want 2 semesters. So either one is totally fine. The important part is also to discuss your plans with your pre-major advisor and the department of your intended major to make sure that in addition to meeting whatever pre-health prerequisites you need, you are getting what you need to graduate to be eligible to declare a major and all of that. If you choose a different set of courses than what we have here in your first semester, that is no problem. A pre-health 4-year plan has a variety of different iterations, and any of them are totally fine. So this second slide is about prerequisites to highlight your decisions around the sciences. Again, we typically recommend taking General Chemistry 1 or Introductory Biology 1 because it allows for the time and space to adjust to both college life in general and the format of lab science classes at UVA, which can be very different from what you've experienced in high school, even if you took rigorous coursework. Students who start with only one laboratory science often find the adjustment easier while still feeling challenged academically. Then in their second semester, many students choose to add on a second science course. But that being said, each student is different. And if you have a strong background in the sciences, if you're bringing in credit from high school, or if you're generally feeling very confident about your ability to do well in these disciplines, it might make sense to take both chemistry and biology. The choice is yours. Both courses are going to be prerequisites for upper level coursework that you'll take later on in the sciences that are required for many health professions programs. One consideration is, at least historically, chemistry for medical school and a couple other health professions is a 5 semester sequence of classes. Usually it has only been offered to begin that sequence in the fall semester. Now, again, the chemistry department is doing some work to make those offerings more widely available. But for now, often makes sense to start with chemistry because that's guaranteed to be offered in the fall semester. Whereas you can take introductory biology classes in any order and start your sequence in either semester, spring or fall. So that's where our chemistry recommendation comes from. However, if you are interested in majoring in biology, just a note that the bio department does recommend that students interested in the major enroll in both intro bio and intro chem in their first semester, but this is not required to be a bio major or pre-health. Again, for behavioral science, psychology or sociology are recommended. For math, we recommend pre-health students take at least one statistics course during their time of UVA, regardless of any credit that you might bring in. And then while we are seeing calculus be required by fewer and fewer schools, for example, only 7 medical schools explicitly require calculus now, many popular STEM majors at UVA require calculus coursework. So keep this in mind when thinking about what math class you might pursue in your first year. Just remember, you won't have the space to take chemistry, biology, behavioral science, math, and other requirements that are specific to your college or school in your first semester, and that is totally okay. We recommend prioritizing at least one science course and then adding in other prerequisite coursework where you can. Remember that you have 4 years, 8 semesters at UVA, lots of time to get all of these things done. So next, we're going to chat a little bit about some unique considerations. We know a lot of our students may come in with AP, dual enrollment, IB credit. And so the important thing to note here is, I mean, A, if you're not bringing that in, that is also totally fine. You're not behind in any way by not bringing in credit. Health professions programs at the graduate and doctoral level vary on whether they accept AP credit and these other forms as completion of a prerequisite requirement. If schools accept the credit, they often recommend completing upper level coursework in the same discipline at the university level. So what does that mean? That means if you bring in AP Bio credit, they say, okay, we'll accept it, but we want you to take upper level biology courses while you're in college to see that you can have a strong familiarity with the discipline and that you've taken some of that coursework more recently before going to your health professions program of choice. Some students decide to retake science courses for which they have earned AP or other credit in order to prepare for upper level coursework at UVA or future entrance exams that require a greater understanding of the material than may have been covered in a course you took in high school. This also depends on when did you take this course. If it was in freshman or sophomore year, you may not be as familiar with the content now to go straight into something like organic chemistry or an upper level biology class. If you elect to retake a course you already obtained AP credit for, you will no longer receive the AP credit to fulfill graduation requirements. So that's just a quick note there. It's very similar with dual enrollment. Most schools will consider dual enrollment credit, though, if you obtained a B or higher in the class. Some students also choose to retake those courses, but I would say sometimes it's a little bit less common than AP. If you're bringing in dual enrollment, just like other types of credit, you are encouraged to complete upper level coursework in the science disciplines to supplement the credit that you're bringing in. Again, we will be happy to chat with you later on. Once you get started in the fall, your pre-major advisor can also talk to you a little bit about some of these considerations. But this is just an introduction. Doesn't mean you have to retake a course, don't have to retake a course. And remember that there's time in case you change your mind later on. I'm going to go ahead and toss it to Kyle to talk about your pre-health path overall.
All right, wonderful. Thank you, Kate. And it's wonderful to virtually meet everyone. I'm excited for all of our new pre-health who's to start here in the fall. And the slides that I'm going to go over are going to feel a little bit overwhelming, kind of doing some future casting, but stay with me. The biggest thing I want to impress here is that the path to medical school or any other health profession is truly a marathon and not a sprint. We encourage people to not rush this process. We find that the best quality applicants are those that truly take their time. And so that leads me into talking about timelines in terms of when you are going to be applying to health professions programs. I know it feels extremely early to start thinking about it. You haven't even started college yet, but it's really never too soon to start considering when you may want to plan to apply, because that kind of shapes some of your decisions for your first few semesters at UVA, especially in terms of academic planning. So, one thing to learn, and a term you're going to hear us say often, is bridge year. This means that you apply to medical school or any other health professions program at the end of your fourth year. And the application process takes approximately a year to complete. And during that time, when the application is processing, you are receiving interview invitations and making decisions on where to attend. That is called your bridge year. Sometimes I will call it an application year. And during the time that that is processing, most students work during this time to continue to learn about and develop their foundation in healthcare, but it's really up to you during what you do. This is extremely common as a pathway, and it has become more and more common over time. To provide some perspective, 86% of successful applicants in our last medical school cycle took one or more bridge years after graduation. So some folks applied after their fourth year after graduation and took one bridge year during that time they worked and their application was processing. Some folks took multiple bridge years, and they might have used that time to strengthen their application in some way, whether that was academic or gaining clinical experience or some other way. And they applied a year after that year and entered that application process that takes a while. So 86% of students in our last application cycle that we have results from took one or more bridge years, and 14% did not take a bridge year and applied after their third year. For context, we have some recent data that shows that was about 20 students in a recent cycle, so it is becoming increasingly less common for folks to not take a bridge year and apply for direct entry into specifically medical school, but this is a trend amongst all health professions. And I will also impress that with this 86% of people that took one or more bridge years, half of them took more than one bridge year. So it is super common, and thinking about this kind of as it relates over time, even related to just 10 years ago, where you might have family or family friends that went through this process, applicants now just have many more steps to complete to get to the application. So again, I will impress that this is a marathon and not a sprint. So when we look at our next slide, this pre-health marathon path, if you will, this is just a common typical pathway for a lot of our pre-health students, and you will see some touch points and reminders that are in blue, pink, and green as it goes throughout your 4 years. And so in the blue, there are different academic touch points like attending orientation and going through your first course registration and taking your appropriate prerequisite courses. And it can just noted that you can also find this on our website. Also in that academic pillar that we talked about earlier, you will have things like your entrance exam and thinking about when to take the MCAT or the DAT or the GRE, and then going through the process of actually applying to health professions programs. The pink touch points are clinical experience. We're not going to talk a lot about that today. We're going to go over that a little bit more in the parents presentation during the orientation session, and then in an event in the fall that I'll talk about in a few minutes. So clinical experience, making sure that that is a consistent touch point throughout your 4 years and during bridge years. And then the green touch points being personal reflection and kind of activities to make sure that you are continuing to grow and mature and develop your personal why for why you want to pursue this. This is a super underrated quality. But it is significantly important, and that is what we're seeing in the application cycle right now is people really trying to articulate their why. So it's never too early to start thinking about it and continuing to reflect on it throughout your 4 years as things continue to change. So you'll note that the paths diverge in the 4th year, like we just talked about with that bridge year. And most will choose that strategic bridge year experience that you kind of see at the bottom there, where they're continuing to gain experience, and then apply to the health professions program, or it will diverge into kind of going throughout the application process if they do not take a bridge year. But this represents kind of the overall pathway. Of course, everyone's path is going to look completely different. I can promise you we have over 400 applicants to just medical school every single cycle, and no one has the exact same journey. So while this is quote unquote standard, everybody's path looks a little bit different. And we will talk about that a little bit more as you continue to engage with us throughout our upcoming events. Another thing to kind of think about and an insider tip that we have is to start thinking about letters of recommendation early. We always debate on whether or not to include this in a Wednesday webinar when students haven't even started college yet. But it's really good to consider because this is a huge blind spot for applicants to health professions programs. And right now we are kind of knee deep in the application process where we're hearing from applicants, I don't know who to ask for a letter of recommendation, and they're kind of wishing that they had started developing relationships with especially faculty members earlier. So good letters of recommendation start earlier and start early. And the tips that are on here, like attending office hours, sitting in the front of the class, saying hello and goodbye to your professor, asking questions, arriving early, staying late to talk, all of these, though it seems small, over a period of time, it can truly make a difference in just the professor knowing who you are and being willing to write a letter of recommendation in the future. So file this away for tips for success as it goes on, and all of, especially your science classes, this will be important to remember. Also in insider tips, we encourage you to build a community. There is no reason why the pre-health community needs, pre-health kind of culture at UVA needs to be competitive. There is enough room for everyone, and we really encourage everybody to think about it as a community. Pre-health feels like it can be competitive because it's a rigorous process and there's certain numbers of experiences, but we really encourage folks to get to know people in your classes and extracurricular activities. There's truly something for everyone to get involved with in terms of gaining pre-health experience. Pictured here are our 10 pre-health advising peers who you may see on grounds or in pre-health drop-ins. They can help you get connected and see what a successful pre-health student is like. You'll have the opportunity to engage with them during drop-in hours during the semester, so fall and spring semesters, which will be Tuesday through Thursday afternoons in Clemens Library. They all have different interests. They're all doing something unique, even though they all are pursuing health professions. So I think that they are a great representation of all types of pre-health students pursuing different things. Even though they're all in this role, they all have their unique pathway and they can talk to you about it and kind of give some advice. So they know more than us about being a pre-health student at UVA. So we really encourage you to get to know them as it moves forward. They can be mentors to you. Okay, so next steps. Lots of things to do after this first touch point in the Wednesday webinar. A few things that you can do kind of immediately. You can browse the pre-health website. It is going to look different in a few months, hopefully a really good different. And so when you get here, there's going to be some new information on our website, but you can start taking a look now and kind of seeing all the resources that we have there. Sign up for that pre-health pulse. The QR code is coming at the end where you can scan it. And follow us on social media on Instagram at UVA Pre-Health. That is where we are consistently sharing information and timely updates for anything that you might need to know. And probably the biggest thing to take away from this is the Class of 2030 pre-health meeting. So this will take place on September 8th or 9th, if we want to go to the next slide. So we are asking you to save the date to attend this meeting in person. It will be in Newcomb Hall Theater, Tuesday, September 8th or Wednesday, September 9th, both at 6 p.m. You only need to attend one session, but you do need to attend this meeting in order to gain access to making an appointment with a pre-health advisor. So after you attend in early September, you will then unlock the ability to make an appointment with a pre-health advisor. So you will learn information about how to register for this by signing up for that pre-health newsletter. And so once you sign up, we will start sending information as the semester gets a little bit closer for you to pick a date to register to attend. So file this date away and scan the QR code here and follow us on social media so you're continuing to gain updates about that pre-health class of 2030 meeting where we're going to give you all of the information that you will need to kind of keep in mind and be successful as your pre-health journey at UVA starts. So next, I think we're going to go into a little bit of time for Q&A. And so if you will put in the chat your name and the question that you have, Kim is going to moderate our Q&A and kind of bounce between the three of us, and we're going to do that for the next little bit. But if you don't get a chance to ask your question today, you can you can come visit us at orientation during the parents presentation. Usually it's at 2 p.m. on day 2 of orientation. And you can come to the pre-health class of 2030 meeting where I guarantee you we will go over all of the details that are going to be important. So thanks so much. And we are excited to answer your questions as we kind of round out our evening together.
Thank you, Kyle. So I realize that Kate has been answering some of the questions on the Q&A, and I picked up a couple of them. So one question, which is early to ask, but we know that pre-health students tend to think of things far in advance, or some pre-health students do. The idea of whether it's better to get a Bachelor of Arts or versus a Bachelor of Science. And this is true not just for pharmacy, which I think was specifically asked, but for all health professions. It is more common for people to apply to health professions programs with a BA, a Bachelor of Arts. Even though some folks would think, well, it makes sense to go for a Bachelor of Science because it has the word science in there. But our health professions programs really do like well-balanced students who have a balanced education. They like incorporating the arts. Health professions are a balance of science and art, the art and science of healthcare. But really, this would be something to talk with your faculty about. If you are somebody who really likes to do research, Bachelor of Science might be right for you, but it is most common, for your information, for students to do a Bachelor of Arts. And so neither one is better, but they will give you kind of a different experience at UVA. The only other question that I saw had to do with newsletter sign up. So if anybody missed the chance to sign up for the newsletter, we can put the QR code back up. But please do feel free to oh, I see. I just saw more information. Okay. Here's the question. I was wondering if having any kind of certification helps increase the chance of obtaining a spot for clinical volunteering at Madison House. Which certification? So I don't think that it helps you with getting into Madison House. Madison House really is a lottery that is, they will choose randomly, but you have to attend the Madison House orientation that happens right at the beginning of the semester. So that's something you don't miss. Madison House is the organization that coordinates all volunteering. And if you miss the orientation that happens at the beginning of the semester, you can't do it again until the following year. So definitely keep an eye out for that. There may be additional information about Madison House on their website. but keep an eye out for that. There isn't a way of kind of jumping the line on that. Although some students, this is just anecdotal information, when you get your first Madison House position, it may be not very exciting, but the point of Madison House is to provide service for others. And so if you're doing medical services within Madison House, that is an excellent opportunity to provide service. And yes, you are getting experience that may be clinical adjacent. It might not be considered clinical right away, but those students who continue on with Madison House over time get more and more responsibilities as they go, and that can be increasingly valuable for your future application. The next question was about graduating in 3 years. It is possible to graduate. It is possible for some students to graduate in 3 years if you've brought in some credit and that kind of thing. However, health professions programs, and I think this was specifically a question about medicine, they use age as a proxy for maturity. And they have outright said this to us. So they don't like it, or they don't have a preference for students who are trying to hurry up. In fact, sometimes they have an aversion for students who are trying to rush through the process. And so keep that in mind. Students who appear to be trying to just get through it quickly for the sake of getting it through it quickly don't usually have a great experience. But students who happen to have gotten through a program in 3 years, have significant clinical and perhaps research experience, who apply, have great success. So it is possible, but I wouldn't recommend thinking about it in terms of time. I would think about it in terms of preparation. I'm actually going to throw this to Kate to see if you have more that you want to add.
Sure, yeah. Obviously, like the decision to graduate in 3 years is one that you don't need to make today, but if that's something you're thinking about, is there a way to complete all your pre-med prerequisites in 3 years? Yes, there is a way to do that. And in fact, a lot of our sample multi-year plans, which you can find on our website, include completing most or all of your coursework in a 3-year period. The question is really going to be, can you get that experiential portion that Kim was kind of hinting at? And so, like, can you get the clinical experience, the research experience, if you're going to participate in research in that 3-year period? So it is challenging. It may be possible. Again, it's going to depend on your unique academic situation, whether you choose, what major you choose, what credits you're bringing in, lots of different factors. But if that's something important to you, we are happy to work with you to try and see if there's a way that that can happen while still preparing you for a successful future application.
Thank you. Our next question, Kyle, I'm going to hand this one to you. Behavioral neuroscience major, would doing both chemistry and biology in the first semester be recommended, or just chemistry?
So the answer to this, you're also going to hear us say often, is it depends. This is truly dependent on your readiness for those subjects and those subjects at the college level. And so most often we do see people start with just chemistry and add in biology in that second semester. That is just kind of what we see across the board most often, but you might have a specific acumen toward biology that you are excited to get started. I will say it does not matter for declaring behavioral neuroscience how quickly you start. Even if you start it in your second semester, you are still able to take the classes. I know you need to complete at least one of the upper level bios by your second semester, second year in order to declare the major. You are still able to do that. So starting with just chemistry does not close the door to any major in particular. Starting with both could be the best option for you specifically, depending on your readiness and your kind of proclivity toward taking those 2 lab science in your first semester. So I'm sorry I can't give a solid answer there. And thank you, Kate, put in the chat to you that some of the department's recommendations and kind of pathways toward behavioral neuroscience. the answer is it really depends from person to person, but you could also reach out specifically to the Behavioral Neuroscience Department for further guidance on that.
Thank you, Kyle. And thinking about that, it's we want to emphasize that we will advise you on prerequisites. We have a good understanding of many majors, especially the most popular majors, so that we can put the prerequisites into context. But we always, always want for you to go and talk with the department, talk with your other advisors about what's right for that particular major. And so during orientation, you will have pre-major advisors who are also oriented toward a number of different majors. They will be on hand if you have questions while you're registering. And like Kyle said, you pretty much can't go wrong in your very first semester. And then you're going to have lots of time to talk with us about prerequisites, your major advisor, your pre-major advisors, and do not feel hesitant to go and talk with the actual department. So if you're like, maybe I'm going to be biology, maybe I'm going to be psychology, or maybe I'm going to be a French major, you can talk with those different departments about what are the implications. We had one French major who did her senior thesis on an application to med school guide in French. And so you can incorporate any kind of major into your pre-health plan and it makes it more fun. Our next question is, while more students, I'm going to hand this to you, Kate. While more students are leaning towards a bridge year or more, do their acceptance percentages significantly improve as they lengthen their pre-health journey?
Yeah, that's a great question. So the short answer would be yes, the acceptance rate and percentage does increase. The other important thing that we'll note based on admissions data that we collect and process each year is that the more bridge years someone takes, we see people get in with a little bit lower of stats. And so by that I mean both cumulative GPA, science GPA, and whatever the admissions test is. So whether that's MCAT or GRE. I think the lesson there is that they value life experience and they value practical experience that people often get during that time. Again, doesn't mean you have to take one by any means, but yes, we see more success among students who take at least one. And I think that if someone happens to take more, that is definitely not held against them. It is helpful in their journey, if anything.
Thank you. All right, Kyle, are there any clubs or groups that help with pre-med and MCAT, such as a group that would help prepare for MCAT and or figuring out how to get clinical and research?
Yeah, so there are lots of pre-health organizations around UVA. Ones that come to mind, American Medical Student Association or AMSA, Phi Delta Epsilon, the pre-medical fraternity, among many, many others. Those are just the first two that are coming to mind right there. There is no club to my knowledge that helps with MCAT preparation. But again, to that idea of building a community. And that kind of helps in the pre-health journey, that information sharing, that is going to be critical in terms of getting connected to clinical experiences and research opportunities and tips and tricks for studying for the MCAT or other entrance exams. So any club is wonderful. It just kind of depends on who you vibe with, where you connect, and kind of what you feel like is going to be the best fit for you. And so no one in particular that, prides themselves on helping with the MCAT or clinical or research opportunities, but all of them are going to provide a pre-health community that are going to help in all of those components.
Great, thank you. All right, this next question, I'm going to guess that you all probably can see the questions. Tell me if I'm wrong, but the next question is about the accelerated chemistry 1810 and 1811. And I'm going to go ahead and answer that. There is not for your health professions program, for your long-term health professions goals, it doesn't matter whether you take the 1800 series or the 1400 series. It doesn't matter. Absolutely doesn't matter. Here's the difference as you think about your pre-health plan is the 1400 series will be General Chem 1, General Chem 2, Organic Chem 1, Organic Chem 2. Those are the 4 semesters. And each of those comes with a lab class in addition to the lecture. With Chemistry 1800 series, it basically does general chemistry in one semester rather than two. Then it goes into organic chemistry. And then in your second year, you're doing organic and physical chemistry. So you're getting a lot more content in the same amount of time. And so accelerated because you're getting more content in the same amount of time. Regardless, for your health professions program, most folks are going to need those 4 semesters. And so it is up to you whether you like to be in an accelerated class where you're learning more. If you love chemistry, it's a really great option. A little bit smaller class. Most of the students in there have some enjoyment or experience with chemistry. Thank you, Kate, for putting that in the chat. But what it might have more implication is how you think about your major and how you think about your non-health professions side of things. And so recommend when you come for orientation that you talk with a pre-major advisor about which one is right for you. But either the 1400 series or the 1800 series will be perfectly fine for your health professions plans. Thinking about the next question has to do with clinical hours during a student's first year. Kyle, do you mind taking that?
Yeah, absolutely. So, considering first year coursework, is it manageable for students to start gaining clinical hours in their first year? The answer is yes. Again, depends on the person and kind of how, how prepared you are for that transition to college. I might not advise kind of jumping in with 2 feet right away in your first semester, kind of using that first semester to explore opportunities and then gaining clinical hours in your second semester, especially if you already have things like an EMT certification or a CNA certification where you can work in the UVA health system. So it's definitely possible, and we see it often. Our general advice is to start gaining experience before your second year at UVA begins. And so for some folks, that is right away in their first semester. They come in and join EMS Rescue Squad, or they kind of take a beat, get used to Charlottesville, get used to UVA, and then kind of start on things in their second semester or even during the summer, spending time gaining certifications. And that is a super popular route that we're seeing a lot of incoming second year students take right now is completing some certification process over the summer. Again, not a rush. The most important thing for you right now is to transition well into UVA and into college. Medical school stuff can wait. We just want you to be the best you right now.
Beautiful. Thank you. All right, our next question has to do with ROTC and military medicine. So there's a longer conversation about this, Anna, and I would say that we recommend that after you have attended the first year class meeting that you come and talk with an advisor about your experience. So there is an ROTC program where they have some additional advising and connections related to military medicine. We also work with students who are outside of ROTC who are interested in military medicine, and so go into either a particular medical school or a particular program that helps pay for medical school through military. And so definitely be in touch. This doesn't have implications for your very first year. Still recommend that you take at least one science course in your first semester. And then after the first year class meeting, the class of 2030 first year class meeting for pre-health, come and talk with one of us about your plans. Okay. Next question is about Madison House. Is this for clinical hours? And so yes, almost all pre-meds have access to clinical hours, but not necessarily through Madison House. So maybe I'll hand that over to Kate.
Sure thing. So, so Madison House is a little UVA, you'll learn, is kind of a unique institution. Madison House is technically not part of UVA at this time. It is a separate organization, but it exclusively works with UVA students. And what it does is connects UVA students to volunteering opportunities in the community. Some of those are healthcare related and in healthcare settings. Many are not. But a lot of students who come in who are pre-health are interested in getting involved with their health and medical services kind of division, which is one of their 4 groups of volunteering sectors, if you will. And so Madison House is one opportunity to begin gaining clinical experience. It is not the only opportunity, like Kim said. There are in terms of access to clinical hours, and I think I can answer maybe a little bit of the next question as well here. We are happy to help talk to you about what clinical experiences are out there, how you can prepare for them, where opportunities are. We do not necessarily have a structure where we will connect you directly with a doctor for shadowing, or we will get you a job in the hospital. What we do is we can talk to you a lot about what is out there, what you need to do to be eligible for some of those positions, what the different options are, what might be the best fit for you, and connect you to people who can talk to you a little bit more. So there's definitely ways that we can make connections, but know that it's not necessarily like an opportunity is given directly to you. It is something where it will take a partnership between you and a pre-health advisor to find something, and then some initiative on your part to make that opportunity happen.
Awesome, thank you. And pre-health students do get clinical experience. There's all kinds of ways to do that. We do have a long list of different opportunities, and we have more ways of exploring that both here in Charlottesville and in other locations, even abroad. Kyle, would you mind answering Gwen's question about EMT certification? If you already have the EMT certification and they're coming into UVA, how easy is it to join local departments without having a car?
Yeah, absolutely. So cool that you already have your EMT certification. One thing I want to highlight actually, I love that you want to join a local rescue squad, and I'm going to put some information in the chat about local rescue squads because there are many across the Charlottesville area. There is a waiting list, and that is going to increase as kind of first years are coming in. So that is something to be aware of, especially for like the main large rescue squads, our Charlottesville Albemarle Rescue Squad. But there are some smaller stations kind of around the Albemarle County area that are not operating on as large of a wait list. So I'm going to put some of that information in the chat. Um, Without having a car, it could be a little bit more difficult, but I would encourage you to still reach out and kind of see what the options are because it's very likely that someone that is on your shift is also at UVA and could give rides kind of to and from the station. So you can definitely work that out kind of amongst other EMS members. But I will also highlight that if you have an EMT certification, you technically are eligible to apply to PCT/CNA roles in the UVA hospital. So this is a certified nurse aide slash patient care technician. It's kind of a dual purpose name within the UVA hospital. And they say that you for either to have a CNA certification or an EMT certification. So that is walking distance, and it allows you to kind of work in the UVA hospital and get paid using your EMT certification. So that's just another option to consider, but I also understand that if you are already an EMT, you are likely interested in running a rescue squad. So I'm going to put the Albemarle Rescue Squads here as well as a link to Lake Monticello Rescue Squad, which is another kind of more rural, but a very popular option for UVA pre-health students.
Thank you. So we've talked about a number of different clinical experiences, but here's what I'm going to recommend. So thinking about where you are, I just kind of scrolled down the Q&A and saw that there's still a number of questions related to clinical experience. And here's what I want to say overarching. As we think about where you are here in June before your first semester at UVA, the only thing that you need to know right now that we don't want you to miss is that orientation to Madison House. That's the only thing that happens right away, quickly before the first year class meeting. In the first year class meeting, which is again September 8th and 9th, we're going to give you some information that's going to connect you with clinical experiences. Actually, Kyle just put part of it in the chat, so you can take a look at that. But there are lots of different opportunities, and we will help you orient to those things. The only thing we really want to make sure, Madison House is absolutely not required, but it's kind of a structured program which helps people get involved pretty early on through volunteering. and doesn't have a huge commitment. So that's why we like to make sure that you're aware of Madison House. I saw a note about grades, grade deflation. Sometimes people ask about grade inflation. I would ask you not to worry too much about that. Grades are what they are. Treat them as real. There's not better or worse schools for health professions programs, but I will emphasize what Kate mentioned earlier, that students who have more life experience, maybe have more clinical experience, maybe take one or more bridge years, tend to get into health professions programs with slightly lower GPAs and entrance exam scores. And so as we think about grades, the point is to learn as much as you possibly can that will help you in your future profession. And if you get to UVA and you have a bummer grade, or a grade that you were not as happy with as you thought you would be or as you wanted it to be, come and talk with a pre-health advisor. We know people who have gotten D's in classes that were prerequisite courses who eventually got into their health professions program. So there is no situation where one grade is going to make or break your experience, but talking with an advisor, asking questions around that is going to be really important. I also see a question about research. That's something to pay attention to during orientation. You will have, if you qualify for work study, some of you may know that now, some of you might not. I would highlight a program called USOAR. It's USOAR. Take a look, do a quick Google search about that, because that's a great program for people who are interested in research, even if you've never done research before. If you don't qualify for work study, there are research opportunities, but they're not super easy to get. And we will talk about that in the class year meeting. So another thing to kind of keep an eye out for. I'm going to ask Kyle and Kate to kind of scan the Q&A, and if there are things that you feel like, oh, we should definitely address that. I'm going to talk about one more thing, and it is math. You don't need to worry, especially if you're looking at linear algebra or differential equations. Don't worry about math as it pertains to your pre-health plans. Everyone should plan to take at least one math at some point at UVA, but you don't have to do it in your very first semester. That's something that you will talk with advisors about either during orientation, and possibly talk to pre-health advisors about in the future. But you don't need to plan on taking a math unless you plan to major in that, and then that would be between you and your future major advisor. What other things are you seeing, Kate and Kyle?
I think we've hit most of them, and I know that Kyle is responding to a few via chat. We had one question about a major, a specific question. In that situation, I would really recommend connecting with the undergraduate coordinator. Her name is Cindy Knight. So she may be able to tell you more about how a biochemistry major specifically might differ from what UVA offers, which is a biochemistry specialization within the UVA Chem major, which is a Bachelor of Science program. In terms of how you will know that your pre-med prereqs are fulfilled, we are absolutely here to help with that part. And so you are welcome to come meet with us after you begin at UVA to start planning those prerequisites and to track your progress through them.
Awesome. And you will automatically be connected with Handshake sometime during the month of June, we believe. So you will have information about Handshake soon. But you won't be able to make a meeting with a pre-health advisor through Handshake until after you've attended the first year meeting. So yes, and the hospitals you can join to get hours, that is again going to be part of the clinical experiences. Check out Madison House. And it is 6:59. I want to say every professor has a different plan for how they are determining what's an A versus an A plus. Some don't even include A pluses. So just know that there's not one answer to that. That's going to depend on your professor. Thank you all so much for being here. We look forward to seeing you in the fall at the class year meeting, and we hope you have a wonderful summer.
All right, this has been our Pre-Health Wednesday webinar. Thank you all for coming. And as a reminder, these recordings will be posted on our website, again, orientation.virginia.edu within the next week, and they'll be there for the remainder of the summer. And, sorry about that. And the if you have any questions that have not been answered by our presenters today, feel free to reach out to their prospective offices directly. And thank you all for coming again. And tune in throughout the rest of the summer every Wednesday from 6 p.m. to 7 p.m. to learn more about resources and programs available to new students before you all get on grounds in the fall. Have a wonderful afternoon.